Interdisciplinary PhD in Progress weekly seminar series phase 3 that I organize in my capacity as the founder and convener of the Global South Network. I'm Dr. Nauman Rayat. I'll be chairing today's session. I'm a lecturer in law at the Leicester Law School, University of Leicester. My research interests lie within the areas of judicial independence, the rule of law, judicial and judicialization of politics in unstable democracies. Dr. Adeniyi Olayode is the first discussant for today's session. He might be joining us at some point. He's a senior lecturer in law at the School of Law, Queen University, Belfast. He researches on the challenges in the criminal justice system, particularly in the prison system, and how penal reforms can be introduced to reduce recidivism. Adeniyi specializes in restorative justice and how restorative justice models could be integrated as part of the rehabilitation program in prison systems of various jurisdictions. Dr. Olayode is a qualified barrister and solicitor of the Supreme Court in Nigeria, as well as a solicitor of England and Wales. He is also a member of the Chartered Institute of Arbitrators, UK. Dr. Lystra Hagley-Dickinson is the second discussant for today's session. She is a staff tutor and a senior lecturer in the Department of Social Policy and Criminology, Open University. Her research employs qualitative methodologies focused on reducing social inequalities caused by race and ethnicity, primarily but not exclusively in criminal justice in the UK and the Caribbean. She worked in Her Majesty's Prison Service, Probation Service, and Community Safety Partnerships, and has undertaken research and published on prison administration and alternatives to custody for the last 27 years. Ebunoluwa Iyamu is the peer commentator for today's session. Ibun is a PhD candidate at the Center of History Sciences, University France. Her research examines the history of Nigeria's prisons in terms of its social political dimensions. In her research, she aims to analyze Nigeria's prisons and understand how they are institutionalized to control and safeguard the labor of past heroes in nation building. Last but not the least, our guest speaker for today's session, O Ikeyi. John is a doctoral researcher at the School of Criminology, University of Leicester. John will present his project titled Colonialism, Socioeconomic Status and Alcohol Abuse, Understanding the Mental Health of Prison Inmates in Nigeria. John, you have 30 to 35 minutes for the presentation, which will be followed by 5 minutes for comments and questions of discussant and peer commentator, and 15 minutes of questions and answer session by attendees. The floor is yours.
Thank you very much for giving me this opportunity. And I welcome all of you once more to the presentation. Like he said, my topic is colonialism, socioeconomic status, and alcohol abuse, understanding the mental health of prison inmates in Nigeria. You know, the research gap in literature is, about, several researchers, our researchers have shown that Nigeria has a very high crime rate, with many prison inmates, exhibiting signs of mental health challenge. And several other research have blamed the rise of criminality, criminal recidivism, and the prevalence of mental health challenges among prison inmates in Nigeria on factors such as lack of adequate medical and mental health care for prison inmates, and many other problems such as dilapidated structures and all that. Additionally, Nigeria is classified among the prominent countries with the highest per capita consumption of alcohol. Therefore, the trans-historical legacies of British Empire and colonialism, such as the obliteration of native norms and the massive importation and unregulated sale of alcoholic beverages, need to be acknowledged and interrogated. Next slide. Yeah, and the research argues that alcohol abuse among Nigerians is one of the effects of the vitiation, debilitation, or obliteration of native norms and epistemes, as well as the people's integrative worldview by British Empire and colonialism. that the criminal justice system in Nigeria still operates under policies which are reminiscent of the British colonial penal system, wherein, though the poor do not commit more crimes than the affluent, they are more likely to confront inequitable practices from the criminal justice system. That's the police, the judiciary, and even the prison. And presently, the structure of Western epistemologies and narratives of discipline and punishment, dominates thought and practice processes in Nigeria, and have failed abysmally to deal with the ever-rising crime rate and criminal recidivism in Nigeria since the colonial era going forward. Western psychological and psychiatric paradigms are unable to effectively treat and rehabilitate inmates experiencing mental health challenges in Nigerian prisons. Therefore, the research argues that there is a palpable need for the legitimation and the incorporation of native epistemic traditions, which have been disproportionately discounted, devalued, and discredited. This is because they reflect the philosophy and cosmology of the people and have proven to produce better results when dealing with social control measures and treatment of prison inmates experiencing mental health challenges. Next slide. Therefore, the overarching research aim is, to fill a gap in extant academic literature by examining the role British Empire and colonialism played in altering patterns of alcohol use, depreciation, debilitation, or obliteration of local episteme and cultural norms and practices, and how these have impacted the burgeoning of criminality and intellectual or developmental disabilities and other mental health challenges manifested by prison inmates in Nigeria. Next slide. Now, background. This section, deals with pre-colonial Nigerian society and its institutions and the impact of British Empire and colonialism, showing how patterns of alcohol use, philosophy of life, and cosmology of Nigerian communities have been decimated by Western imperialism. This presentation shall briefly highlight a few of these issues due to time constraint. And I'll start with alcohol. Except where alcohol beverages are prohibited, mainly for religious reasons, they were and continue to be used for marking several locations in Nigeria, such as offering to deities, spirits, or in memory of dead ancestors during religious rituals. It was also used during celebrations of major life transition events, such as coming of age, marriages, and initiation ceremonies. Alcohol beverages are also used for marking the resolution of both individual and community disputes, funeral ceremonies, celebration of birth, entertainment of visitors, and title taking. It was also used to reward labor and was commonly given to traditional rulers and elders as tribute. And without it, village council meetings for different purposes could not take place. Hence, it was not used merely as a source of enjoyment, but as a social necessity. When used in this manner, intemperance or intoxication and other related problems are clearly forbidden. Now, although it was used for a wide It was used and continued to be used for a wide range of purposes. The quantity available on any occasion would not allow for excessive consumption. Additionally, these events were held at the extended family level. So drinking took place along family lines, and it may take several months for the same family to come together for another celebration. And so drinking was not a frequent event. Usually, each person would not get more than between 20 to 50 cl of alcohol on any occasion. Secondly, there were traditional norms and strictures which guided, the use of alcohol. For example, only full-grown adults were allowed to drink, and where children were permitted, adults supervised them. Again, any adult who was intoxicated was punished by forbidding such adults from drinking alcohol for a specified period of time. And the alcoholic beverages were not sold in any market or shop. So no matter how anyone cherished alcohol, it was not possible to buy. Furthermore, local alcoholic beverages are produced from a wide range of grains depending on what is available in a location. For instance, in the north, they use maize, sorghum, millet, and other grains to produce their own alcohol. While in the south, they use the banana, or oil palm, and raffia palm trees, which were also used for human and livestock feeding. So that regulated, the quantity that was available at all times. However, British colonialism changed this pattern of alcohol use by the massive importation and unregulated sale of spirituous alcoholic beverages, which had higher alcohol or ethanol content. This also obliterated the traditional norms and strictures guiding alcohol use by offering it for sale and taking it away from the communal setting. This development fostered the growth of bars and shops where alcoholic drinks were sold. Thus was the prelude to alcohol abuse and related problems in Nigeria. Now I move to mental health care. Prior to colonialism, traditional medical practices had thrived as the only way to meet the health needs of the local population. The traditional Nigerian healthcare delivery system included a robust psychiatric specialty, which was geared towards the restoration and reintegration of persons experiencing both major and minor psychiatric problems as reasonable members who could make significant contributions towards the development of their societies. This treatment model reflects its sociocultural environment and is based on traditional and cultural belief system, which derives from the people's ontological principles and cosmology. This ontology and cosmology explain the human being as a product of physical, spiritual, moral, and social dimensions. And these four dimensions must function harmoniously for a person to be healthy, while the dysfunction of any of these four dimensions signals ill health or sickness. Therefore, physical and mental illnesses are perceived as the result of disturbance in this harmony between an individual's cosmos, such as the family, the society, peer groups, job, ancestors, deity, or religious beliefs, and then the individual, this crisis between individual and his cosmos. Many Nigerians believe that to be able to cure mental health challenges, recourse should be taken to traditional religious and cultural practices by taking persons afflicted with mental health challenges to traditional healers. This practice is predicated upon the belief among many Nigerians and Africans in general that mental health challenges and other brain defects which are related to supernatural causes or even other causes can only be effectively cured after performing sacrifices, as the case may be, to appease these ancestral spirits or deities. And that any effort to cure such defects using orthodox or Western psychiatric therapeutic models will not achieve the desired results. Although the traditional mental health care practitioners have experienced obstacles and restrictions due to the introduction of Western medical paradigm from colonial era going forward, they have been providing efficacious therapeutic services to majority of people experiencing mental health challenges, due largely to the obvious failure of Western therapeutic models in Nigeria. Then I move on to criminal justice. Prior to the arrival of British Empire and colonialism, Nigerian communities had developed some indigenous mechanisms of crime control. Therefore, it would be wrong to claim that the criminal justice, law, and order were creations of British imperial contact with Africans. Within the Nigerian pre-colonial Nigerian society, the issue of maintenance of law and order, as well as the dispensation of justice, was managed by members of the community, deities, and ancestors. At the human level, crime control and other law enforcement obligations devolved on various layers of pre-colonial governmental institutions and agencies within the community, such as the nuclear family, the extended family, the village, the age grades, and the town, represented by the traditional ruler where one existed, or a council of elders, depending on the subject matter, geographical and hierarchical jurisdictions. However, all these organs functioned within the theocentric justice delivery system, wherein crimes and other malpractices were associated with the cosmic and esoteric activities, which must be addressed by reference to God. This God acts through different deities and ancestral spirits, which serve as intermediaries where and when necessary. The ultimate goals of pre-colonial judicial system in Nigeria were to restore the victim, reintegrate the offender into the community after admonition, and promote reconciliation. This was achieved through a negotiated and interactive process involving the community, the offender, as well as the victim, and involves paying serious attention to the needs of the victims, the society, and human dignity generally. Punishment were meted out to offenders to mitigate the effect of the harm and compensate for losses suffered by the victim, rather than in strict obedience to the law or for the purpose of deterrence. Thus, the judicial system was centered on the victim and the application of credible and restorative principles in resolving both criminal and civil matters. It was governed by humane principles, promoted the participation of all stakeholders, and decisions were reached through compromise, wherein the assessment of injury and search for resolutions were made in consultation with the victims, the community, and even the offenders. Thus, effective social control was achieved through a juridical and jurisprudential system which derived from cultural values of morality anchored in the traditional religion, where individual actions were evaluated through the approved value system of the society, and upon which the justification or otherwise of such actions are based. The effectiveness of this system suggests that the maintenance of social safety can be achieved by the application of social sanctions, even when punishment is not integrated, and that immersing the justice system in the daily life of local communities, rather than centralized and depersonalized institutions of contemporary criminal justice system, is more practical and real. However, with the advent of British colonialism came the establishment of a new criminal justice system and a criminal code utterly driven by the expediency of trade and the protection of capital. For instance, to show that it wasn't driven by crime, a British official in 1944 found that the number of persistent and professional criminals is not great. Crime as a career has so far made little appeal to the young Nigerian. This new criminal justice system functioned to legitimize the hegemonic relationship between colonial officers and the natives, as well as to promote the furtherance of a more economic and political imperial agenda, which was the exploitation and maintenance of social control over the colonized natives. All these changes brought about by British Empire and colonialism, whether it is in alcohol consumption or mental health care or criminal justice system. Rather than ameliorate these problems of crime, criminal recidivism, and mental health challenges, exacerbated them, thereby leaving Nigeria presently at crossroads. So next slide. Yeah, the literature review is organized thematically, reflecting the following themes: alcohol and crime, alcohol and mental health, alcohol misuse and socioeconomic status, socioeconomic status and crime, mental health and crime, mental health and prison. I'll just give a snippet, of part of the literature review by way of summary. A considerable number of studies have established a large and statistically significant relationship between excessive alcohol consumption and involvement in crime. It has also been revealed that alcohol abuse has a vitiating effect on human mental health and capacity, either through the effect of direct excessive consumption by an individual or through parental alcohol exposure during pregnancy. Additionally, the literature review has also established that one major reason for indulgence in alcohol abuse is the feeling of despondency, powerlessness, depression in the face of extreme violence, and other adverse situations, such as those created by British Empire and colonialism during periods of protest by natives, and many more. A person diagnosed with psychosis is at least 6 times at a higher risk of committing a violent crime than a person who is mentally stable, while a significant relationship has been established between having a higher rate of criminal conviction for a diverse range of criminal offenses, including violent criminal acts, and suffering from schizophrenia and substance abuse. Over a lifetime, an offender suffering from schizophrenia is likely to have 2 times more convictions for a wider range of criminal offenses, including violent crime, than offenders without schizophrenia. And the conviction rates have been excessively affected by persons diagnosed with comorbidity of substance abuse and schizophrenia. Moreover, the reviewed extant literature also indicates that imprisonment has an impairing effect on mental health, due largely to the fact that the physical, psychological, and social landscape of prison signify that prison setting, its rubrics, and daily living are very harmful to mental health and has capacity to push people already struggling with cognitive disabilities to severe mental health disorders. Next slide. Yeah, to adequately address the proposed research questions, the research is based on the ontological philosophy of relativism and the epistemological paradigm of social constructivism. In line with the research paradigm, the research adopted qualitative methods, and the participants were selected through a process of purposive quota sampling. Consequently, 6 prison inmates, 3 asylum inmates, 2 ex-inmates, 8 prison officers, 9 retired prison officers, 10 prison clinic staff, 2 officers of non-governmental organizations, and 5 judges were selected. While 26 of them participated in face-to-face interviews, 19 participated in 2 focus group discussions. Thus, a total of 45 participants took part in the research, selected from 3 prisons and 3 judicial divisions from 3 different states. The primary data were collected through semi-structured face-to-face interviews and focus groups. The 2 methods of data collection used helped in achieving greater depth and generating a nuanced and more informed understanding of the participants' social world. The data collected were analyzed through thematic analysis, and research adopted two coding methods. First, data generated were analyzed in using open coding, where overt and covert meanings were fully articulated and understood. Secondly, in vivo coding was used due to the number of participants and through a critical appraisal of academic literature. These codes were conceptualized into sub-themes, while the thematic framework approach was applied in the classification and organization of the data according to key themes. Next slide. That what? No. Data collected. The data collected we've gone through. Okay, the next one is go to the theoretical framework applied in the study. The study used decoloniality. That's the decolonial perspective or framework, and in using that, it incorporated what is called biopolitics of colonial carcerality. Now here, by decoloniality, we are referring to a theoretical framework which concerns itself with the transformation of the epistemic landscape in such a way that people's ontology and cosmology are straddled with the knowledge production processes, thereby making sure that the knowledge produced reflects, the needs and aspirations of those who are supposed to benefit from such knowledge. In other words, making sure that the knowledge produced is cognizant of and responds to the local needs of the people. In this regard, it calls for the ending of epistemic hegemony and the recognition of other epistemic traditions, which have been negatively impacted by the Euro-American logic of modernity. This framework recognizes that in the domain of knowledge, the idea is not to exclude for exclusion's sake, but to be as inclusive as possible. Therefore, it pays attention to other epistemic frameworks, principles of knowledge, understanding, and ethics, and advocates an Orientalist discourse which possesses the capacity to unpack these colonial patterns entrenched in development thinking. Decoloniality pursues an understanding of the challenges posed by the problem of Euro-American logic of modernity to African development, since it creates difficulties for the emergence of alternative to current Eurocentric neoliberal thinking. Hence, it perceives this logic as a form of coloniality. The biopolitics of colonial carcerality reveals how carceral social control systems, first developed in the colonial era, have across time continuously targeted vulnerable populations, particularly persons living in challenging socioeconomic conditions, and those of them grappling with intellectual or developmental disabilities and other mental health challenges, framing them as biological threats and treating them as contagions, germs, or pollutants that must be eradicated to ensure the prosperity of society. It refers to a policy of governmentality in ex-colonies, which relies on the sustenance of colonial practices characterized by violent punishments, the dehumanization and perpetuation of enduring harm on poor, resistant natives through criminalization and incarceration. Biopolitics of colonial carcerality explains how colonial forms of carcerality has shaped prisons in post-colonial era and continue to influence them today, thereby exposing the link between the past and present. This means that the process of ordering and dehumanization, which contemporary prison populations experience in Nigeria in the present, is conceptually similar to the processes of ordering and dehumanization under colonialism. Biopolitics is the use of power to frame human life in terms of biological problems affecting the population, while colonial carcerality denotes the extension of imperialism and colonialism through the renewed presence and practice of the ideologies of colonial criminal justice system, particularly the prison system in erstwhile European colonies. This concept reflects how privileged persons who find themselves at the top of the social hierarchy are let live through policies and processes which sustain and enrich their living, while the most susceptible persons, such as persons living in challenging socioeconomic circumstances, and those contending with intellectual or developmental disabilities and other mental health challenges, who are at the bottom of the social ladder, are let die through governmentality, which discriminates against them, both socially and materially, and deprive them of their humanity. Next slide. Excuse me, can I have water?
John, you have 5 minutes are left, okay?
Oh, findings. Now, let me just take summary of the findings. I wanted to read out some snippets from the field work, but let me just do this, the summary of all of them. Now, team 1, the findings reveal how through corrupt practices, people living in challenging socioeconomic circumstances are those experiencing intellectual or developmental disabilities and other mental health problems among them are sent to prison over spurious charges by the police. They also highlight how administrators and operators of the criminal justice system have continued to run the system along colonial policies. This scenario indicates that official criminalization may be a function of the structure of dominant and subordinate relations within populations rather than the incidence of crime, and that who goes to prison in Nigeria is often about socioeconomic status rather than guilt or criminality. Then for team 2, I summarized it again. The findings show that living conditions in prisons are characterized by overcrowding, poor feeding, shortage of water, unsanitary conditions, and all that. Furthermore, remand inmates constitute over 2/3 of the prison population in Nigeria, with people of low socioeconomic status making up more than 90% of the inmates on remand. The finding reveals the deplorable living conditions in Nigerian prisons and how people living in challenging socioeconomic situations are sucked into prisons and treated as subhumans. This is reminiscent of colonial systems of control and subjugation of indigenous peoples. The third theme, which is mental health of prison inmates. The findings indicate prevalence of mental health challenges in Nigeria prisons and the lack of capacity by prisons to handle such problems. They also show that access to mental health care service in Nigerian prisons is entangled within a socioeconomic framework. Thus, most of the inmates experiencing mental health challenges are locked up without treatment because they cannot afford the cost of treatment. The finding also is reflective of epistemic hegemony or colonial mentality, wherein traditional medical practice is prohibited by prison authorities, irrespective of its efficacy. And finally, team 4, which is alcohol. The finding revealed that alcohol abuse promotes crime, irresponsible lifestyle, and can cause mental health challenges. Most people who engage in crime misuse alcohol, and alcohol is the most abused psychoactive substance in Nigeria. They show that any serious effort, the findings show that any serious effort aimed at fighting crime and mental health challenges among prison inmates in Nigeria must endeavor to address the problem of alcohol abuse. Furthermore, they indicate that the problem of alcohol abuse in Nigeria is a legacy of British Empire and colonialism, and is one of the effects of the vitiation, debilitation, or obliteration of the native norms and the people's integrative worldview, by British Empire and colonialism. Thank you. Maybe I end at this for now. Thank you, because my time is up.
Thank you very much. Thank you, John, for such an excellent presentation. Clearly, you made a lot of progress since we met last time. It was, I think, a year ago. So a lot of work you have already done. Now I invite Dr. Adeniyi Olayode to share his comments and raise questions if there is any. Dr. Olayode, over to you.
Thanks very much, Norman, and hello to everyone. First of all, I'd like to apologize for coming a bit late. I had some technical issues trying to join in, so my apologies. And thank you very much, John, for your presentation. I found it very interesting. I found it, and also for various reasons. One, particular aspects of your research closely aligns with mine with regards to, first of all, because my research looks on both two key aspects of my research, both on prison system in Nigeria as well as the use of restorative justice in Nigeria, particularly with regards to the second. Restorative justice, modern restorative justice, closely aligned with a lot of our indigenous traditional practices. So I was happy to see how you've examined it and trying to put forward a case. And I'll encourage you to look into restorative justice if you've not looked into it, and see whether it could be introduced into the Nigerian criminology system. Look at possible arguments there. I guess I need more clarity in regards to one of the key aspects of your presentation in regards to the use of alcohol. Tying the fact that the true British colonialism, alcohol was introduced and led to the destruction of or destabilization of a lot of traditional principles. And I just wanted much more clarity with the sense that, is it the alcohol, and for what you have said in your presentation, you seem to be arguing alcohol, the substance, as in the actual substance, but not the alcoholic culture, which the alcoholic culture. So I'm not quite clear. Are you arguing that the introduction of alcohol has led to us losing some of our traditional values, or is the alcoholic drinking culture? Yes. So that's one of the first things I need clarity on. Then also, I was wondering, have you also considered, apart from cost, I'm not disputing the fact that British colonialism and imperialism has really had a negative impact, on various aspects of Nigeria, including our justice systems. But also, we cannot do away with the years of military rule. We actually spent at least from 1966 to 1999, apart from a brief 4-year period, over almost 30 years of military rule. And of course, military rule, one of the key aspects of military rule is the absence of upholding the rule of law, as well as the inhumane and cruel treatment, that comes with the military rule. And of course, those who are Nigerians who are here listening could be able to testify to that. So I'm wondering if you've not considered whether military rule actually played its role. Maybe not as much as several years of British imperialism, but you cannot do away with that particular part of our history. It's part of the Nigerian history, and for some, it's still, the abuse that was suffered during the years of military still plays a role even today. So I'm wondering why that was not, you didn't consider, the impact of the years of military rule, on specifically regards to the Nigerian criminal justice system, regards to the way prisons were used, because for during the years of military rule, prisons were basically used to imprison anyone who didn't comply with military rule, the military decrees and edicts. So they went that they just. Unfortunately, they just followed from the colonial masters, and even some may argue expanded into much more cruel forms of treatment. So why that part of Nigerian history, chunk as it is, no matter how small, but still important, why that is missing from your research, I really like to know. So yeah, that's my questions and comments for now, but very good job. Well done, John.
Thank you, Dr. Olayode. for your comments and questions, which are indeed clearly very useful. John, would you like to respond to comments and questions now, or should we go first to Dr. Lystra and collect more comments and questions and you respond to them collectively?
Whichever one is all right by me.
Okay, so then in that case, let me invite Dr. Lystra Hagley-Dickinson, a senior lecturer, School of Criminology, Open University, to share her thoughts and raise question if there is any. Over to you, Dr. Lystra.
Yes, thanks, Ramnath, and thanks very much for inviting me to be a discussant here this afternoon. And John, thank you so much, because in some ways, I know little about the Nigerian carceral network, or industry, as I like to refer to prisons, in a decolonize or decolonization debate. So thanks very much for taking us through some of that, and I found most of it very enlightening and informative, because I particularly resonates with me in terms of the prison industry, the comparativeness of prisons in colonial and post-colonial places, because I come from the Caribbean. And again, prisons it has been and is still one of my key research passions with regard to prisoners and prison administration, particularly within the context of Caribbean prisons, and probably not so much in terms of developing that coloniality aspect, but clearly within terms of the historic issues around identity and the provisions of reducing our indigenous approaches to accepting the still colonization of our criminal justice system, even though we have become, republics and independent nation states. For me, I really liked some of your what you're trying to do in terms of the threads, and I suppose my core question really relates to the whole issue of I am not too sure what your research question is. In terms of what you're trying to answer, I can see the framework, the context, and so on, and even the probably the gaps, but I'm not quite sure what is your research question, and I suppose that's a practical question in terms of the PhD agenda. And I think that ties in very much with my colleague Ade, who was asking about, because for me, when I read it, I thought, I couldn't find the connections between your themes of the alcohol and the mental health. I could see why they were important, but I couldn't see, I put here in my comments something about with regard to slide 6. I could see the themes, but I couldn't see how they were connecting to help your argument. And I have here, is mental health a cause or effect of the increase in incarceration in Nigeria? How does that link to the criminalization? Because I think you're talking in terms of concepts around what does that criminalization mean, and therefore then the response is in terms of high numbers of imprisonment. Because I'm assuming people can't do alcohol in prison. So therefore, I think I want to know how these factors, you're connecting up these factors to make that rich argument that you're trying to do with regard to showing how these structures, are still very much colonial structures, and colonial jurisprudence is still so heavily determinant of a criminal justice system. So that's the second of my key questions. And then to add to that, I thought, the themes need to also explore that counter narrative in terms of indigenous approaches. And again, I think that ties in with Ade's discussion around, as it appears at the moment, the thesis seems to say all the problems with Nigeria prison system is because you were colonized. And I think that needs to be, pulled apart and unpacked a little bit. One, in terms of other histories influencing it, but the counter narrative as to what are those indigenous approaches that probably should provide, that transformative challenge to post-colonial developments in criminal justice. I think I've done my 5 minutes. Sorry. Thank you.
Thank you. Thank you very much. Thank you, Dr. Lystra, for comments. I must say that I have very limited knowledge, expert knowledge about prison system. But after listening to your presentation and the comments, I can see the broad similar patterns between Nigeria and other jurisdictions, including Pakistan. So, John, would you like to? I don't think that it's a good idea to go to the peer commentator and collect more comments. It might be overwhelming for you. So let's you respond to these comments, and then we will go to Ebunu.
Yeah, thank you very much. Yeah, thank you so much for your contributions. I appreciate them because in the first place, they'll make it better at the end of the day. In reaction to some of the issues, for instance, Dr. Olayode said something about, alcohol culture, whether I'm talking about alcohol culture or whatever. No. What I'm talking about is the change in pattern. Alcohol has always been there, like I noted initially. Alcohol has always been there in Nigeria. But the pattern of consumption was changed by the massive importation and unregulated sale by the British empire and colonialism. And that was, the beginning of problems of alcohol abuse in Nigeria. Like I noted in the work, people were drinking alcohol in Africa, in Nigeria and other places. But in Nigeria particularly, because, the materials needed for the production were also used for human and livestock feeding. It was not possible to even produce as much as people could drink and get drunk. You understand what I'm saying now? And then there were occasions that alcohol, were presented. You couldn't go to any market to buy alcohol. It was the British Empire and colonialism that made alcohol an article of trade. So if you cherished alcohol so much, you could spend all your salary drinking alcohol. So long as you pay the seller, he will sell to you. So it's about the pattern that I'm bothered about. That's the concern of this thesis. The pattern of drinking. And it was this pattern that they changed that created problems of alcohol abuse. And then alcohol abuse in itself, from the extant literature, is a factor in crime. It's difficult, it's because of the time constraint. I would have, brought out some of the quotes, more snippets of quotes from the participants. Like one of the judges said, it is not easy for anybody to take that plunge into criminal activity without knocking off his head. That was the word he used. You need to be under influence for you to plunge into serious crime. So alcohol consumption and abuse particularly is a factor in crime. Now, talking about military rule, yeah, I appreciate that the damage that the military rule did to Nigeria. But in terms of my thesis, it's not very important because I'm looking at the people of low socioeconomic status. The military used power and prison for their opponents who are not these poor people. It was used to, emasculate those who were resisting them, and the poor were not among those. So, that was why it didn't, I didn't reflect it in my work, because if you look at the title, it's talking about socioeconomic status, and it's not about, because if I widen it, it may be difficult to come within the word count. I hope that makes sense.
Thanks, John. Thank you very much for the response.
Yeah,
talking about go ahead.
Yeah, the criminalization, alcohol and mental health, like she asked me, criminalization. it's not just about criminalization. It's not about just the prison estate. It's about, you know, what alcohol has done to some people. That, you know, if like there were a lot of instances in my research where prison officers and even retired officers cited instances where people committed crimes because they were under the influence of alcohol, and by the time they were arrested and kept maybe in the police station for like 24 hours, and they got themselves back, they started regretting. There was one instance of a young man who killed his father and stepsister. He went to drink, came back, and his father was telling him that the land they wanted to sell, they've sold it. He now started asking for his own money instantly. And his father was telling him, how can you get this money this night when the money is in the bank? Wait and take it. Tomorrow you take your own. Because he was under influence of alcohol, he started making trouble. By the time his half sister came out from the room to ask what was the problem, he used a pestle and broke her head, and she died. While his father came out to say what was happening, he also killed him. And when eventually he was sentenced to death, he preferred to die because he felt the shame, he had brought upon himself was too much that he couldn't go out to the society anymore. So, we're looking at, talking about the research questions, we're looking at the impact of alcohol on, crime, responsible lifestyle. So people should be able to, people who take alcohol are not very likely to live responsible, who abuse alcohol, sorry. People who abuse alcohol are not likely to, lead responsible lifestyles. They are not able to pay their children's fees and all that, and many other.
John, sorry for the interruption. Let's go to our peer commentator. She might raise similar questions, so you will have the opportunity to, explain whatever you couldn't explain now in response to her comments. Over to you, Ebunu.
Thank you, John. Thank you, everyone. John was, forgive me, was a beautiful presentation. Good topic, but my comments are coming from the stand of an historian, also working on history of punishment and prisons in Nigeria, colonial Nigeria. So the first one I'm going to say is that there's not a strong connection between your topic and the content of your work. There's a lot of distance from what you presented, your abstract and your topic. So those are three different things. Again, as an historian, it's a lot of problem when you use too much terminologies in your work or conceptual frameworks, conceptual ideas. I could count over 6 or 7 conceptual or theoretical framework from your work, from your presentation, from your thesis, from your abstract, and from your topic. So it's too much. So it's preferable you focus on just a single one to help you construct your ideas properly. And the other aspect I want to talk about is on just like a suggestion. So following your presentation, I feel you're trying to look at punishment as a social cultural construct instead of you going all around looking at alcohol consumption, the impact on prison, the impact of colonial legacy. So looking at punishment as a social construct, social cultural construct, kind of link into the pre-colonial culture or pre-colonial structure of how alcohol consumption is being perceived, how colonial rule perceived it, and others. And the other part I also want to talk about is your research question. So I think it's almost impossible for you to have like a whole PhD thesis without having a research question. Well, our research questions can change as you work, but it's very important for you to have a very good constructed research questions, which leads to your to the perfect conceptual framework you're going to use, and which is also going to lead to the sources you're going to use. This leads me to the next aspect of my comment. It's about sources. As a historian, you don't rely basically on interviews, because interviews has its own flaws, right? And so there's so many. I also want to ask a question about your sources, because all I could see and what you've told me is about interviews. There are so many sources you can use, primary sources you can use. Like someone also working on your similar topic, I'm using like private diaries, colonial laws, and every other thing. And that reminds me, there's a colonial law called the Vagrants Act, which could really help you in redefining or restructuring your questions and your research, and also the aspect on lunatic asylum, how the British prisons created its own mental health prisoners and mental health hospitals, could also help you, restructure it instead of you looking at the whole of colonial rule. I think that's summarized all I have to say, if that's okay.
Thank you very much, Ebunoluwa. Thank you for your useful comments. I think now we have also received a historian perspectives as well. So it's a lot of interdisciplinary discussion going on. Before I go to John, so that he can respond, let me collect, briefly a question from Yusuf. Yusuf, I will request you to be very brief in raising your question. Yusuf, are you there?
Yeah, I'm there.
Thank you. Please be brief, okay?
Yeah, thank you very much. Obviously, I'm going to be brief because many of my comments or observations have actually been covered by the last three speakers. So I'll just quickly mention methodology, and it obviously connects to what other speakers have said. Methodology, especially where, I have to first acknowledge John's efforts. It's course of time I had to jump into. So, but methodology, especially how you want to establish, how you want to validate your claims of what has happened before colonialism came about. So, because you're trying to establish a market change, something that changed with colonialism. So, and then you've made a lot of claims as to what used to happen. But when I look at your methodology, your interviews and all are centered around magistrates and the current prison system, as opposed to the parts you've mentioned before. But I know that the historian has mentioned some of the things you need to do, but that was just my question as to how you are going to, your methodology for establishing what happened before and then before the change came about. So I wish you all the best in your research, and thank you very much for the opportunity.
Thank you, Yusuf. Thank you, Yusuf, for such a useful question. John, would you like to respond? You don't need to answer all questions and comments because, of course, it's a work in progress. So you can always go back to the recording and then, see. So over to you, if you would like to respond.
Just very briefly, in terms of methodology, what I reflected on here was just the primary data. In my work, I use historical sources. I have works from I've been consulting Kew Gardens, National Archives, and all that, and even in Nigeria. But you see, part of the problem is like the time I have to present is short, because even when we talk about research questions, I couldn't have been doing even my probation report must have research questions. So all those things are there. I just took out a piece from here and there to make the presentation. So I have other sources. It's not just the interview. Like I said, I did interviews. I did focus groups. I have secondary sources of data which I'm using. Like you talking about. Pre-colonial, colonial asylum system. I have a lot of work on it, including the one done by Sadowski, and even what has happened at Aro, somewhere in Ogun State, by Dr. Lambo, Professor Lambo. I have all those works, But what I just brought out was the skeleton. It's not the because of the time constraints. So I think I appreciate the criticisms, and it makes sense to me.
Thank you very much. Thank you very much for the response. We have time for only one question from attendees. If there is any question, please feel free to. There's already a comment there from Diane, but I'm not going to read it out. John, you can read it out because people are already in touch. So later on you can follow up on that. But if there is any question from attendees. All right. Okay. So in that case, many thanks, John, for excellent presentation. Thanks, Dr. Olayode. Thanks, Dr. Lystra and Ebunoluwa for useful comments and questions. Thanks all for attending the session. Same time next week, let's meet our next guest speaker, Chandini Subramaniam, PhD student, Population Health Sciences, University of Leicester, will present her project titled An Intersectional Study of Family Carer, examining the interaction between ethnicity and young adulthood to develop appropriate support. Look after yourself. Have a great day. See you next week.
Thank you.
Bye-bye.
Bye.